what we eat, and how we live our lives can have an important impact on our heart health. Hello, my name is Debbie Davis. I am a registered dietitian with Doylestown Health. Today we are going to talk about how we can lower cholesterol naturally with diet and lifestyle changes. Cholesterol is a waxy, fat-like substance that's found in all cells of the body. Your body needs some to make hormones, vitamin D, and substances such as bile acids, which help our body break down the fats. Our liver produces cholesterol. But when there's too much cholesterol in your blood, it builds up in the walls of your arteries. This causes a form of heart disease called atherosclerosis. The arteries become narrowed and blood flow to the heart muscle is slowed down or blocked. There are two forms of cholesterol that you may be familiar with: low-density lipoprotein, LDL, or what we call the bad cholesterol, and high-density lipoprotein, HDL, or our good cholesterol. LDL cholesterol has an important job. It transports cholesterol and fat from the liver to the rest of the body. LDL gets a bad rap because it's also the main ingredient in the plaque in your arteries. HDL cholesterol comes along and mops up this excess cholesterol and brings it to the liver for disposal from your body. Most of the cholesterol that your body needs to function each day is manufactured in your liver. Family history affects this amount of cholesterol that your body makes and the way your body controls the levels. Only around 25% of the cholesterol comes from the foods that you eat. If you eat a healthy diet, your liver manufactures just as much cholesterol as you need to supply your cells with what they need. But if your liver makes too much cholesterol, which is often an inherited problem, or if you take in too many calories, especially in the form of certain fats and sugar, your cholesterol levels rise. Too much cholesterol in the blood can build up in the walls of blood vessels and block blood flow to tissues and organs, and increase your risk of heart attack and stroke. So let's discuss changes we can make to our diet to improve our cholesterol. First, choose healthy fats. One of the types of healthy fats are monounsaturated fats. They can lower your LDL, and they may even raise your HDL or good cholesterol. Some food sources of these healthy monounsaturated fats include olive oil and olives, avocados and avocado oil, nuts and nut butter such as peanut butter and almond butter. Another type of healthy fats are polyunsaturated fats. They can lower our LDL cholesterols and also lower our triglycerides. High triglycerides may increase your risk of heart disease. Omega-3 fats are a type of polyunsaturated fats. Good sources of omega-3 fats are cold water fish such as salmon, mackerel, and sardines. Other foods that contain omega-3s include walnuts, sunflower seeds, flax seeds, chia seeds, tofu, and certain vegetables. But not all fats are healthy for us. Foods that contain saturated fats can raise our LDL cholesterol. Most saturated fats come from an animal like meat, poultry, dairy, butter, and cheese. Also, many baked goods and fried foods can have high levels of saturated fats. Trans fats are another type of unhealthy fats. They are actually double trouble. Not only do they raise your LDL cholesterol, but they also lower our good cholesterol, the HDL cholesterol. Trans fats are mostly found in processed foods such as baked goods, snacks, fried foods, non-dairy coffee creamers, and stick margarines. To find out if a food contains trans fats, check the food's ingredient list for partially hydrogenated vegetable oil. To keep our heart healthy, replace your saturated fats such as butter and lard with olive oil and avocado oil. Also, eat less meat and instead eat more fish, nuts, and seeds. In addition to choosing healthy fats, it is important to eat foods that have soluble fiber. So why is soluble fiber heart healthy? As we discussed earlier, bile acids, which are made from cholesterol, break down and use the fat and the vitamins from foods. Foods that have soluble fiber grab the bile acids from the digestive tract before it can be deposited into your arteries. Imagine a jelly-like blob that traps the cholesterol and gets rid of it before it can harm your arteries. If you eat just 5 to 10 grams of soluble fiber each day, it can reduce your LDL or bad cholesterol by about 5%. Oatmeal is a great example of a food with soluble fiber. As I just mentioned, oats are a great source of soluble fiber. Other sources include beans, flax seeds, and fruits and vegetables. So how can you include more soluble fiber in your diet? Eat oatmeal for breakfast. Add beans to your salad or enjoy them as a side dish. Sprinkle flax seeds on your cereal or yogurt and eat plenty of fruits and vegetables. Besides food sources of soluble fiber, the Food and Drug Administration, or FDA, has approved psyllium fiber as a supplement to lower cholesterol. Psyllium fiber is found in Metamucil. For best cholesterol-lowering results, take 3 servings of Metamucil daily. Every time you take a dose of Metamucil, it's critical to have a full glass of water with it. However, psyllium fiber may form some gas and cause bloating and abdominal cramping. So don't start out with the full 3 servings. You'll need to work your way up to this amount to help prevent those side effects. Fruits that are high in soluble fiber include apples, pears, avocados, citrus fruits, berries, figs, passion fruits, apricots, and prunes. Vegetables that are high in soluble fiber include peas, carrots, corn, squash, Brussels sprouts, turnips, and sweet potatoes. Fruits and vegetables are also a wonderful source of niacin. Niacin has been shown to lower your total cholesterol, your LDL, and your triglycerides. It can also raise your good cholesterol, your HDL. Some of the best sources of niacin include avocados and vegetables such as asparagus, peas, potatoes, mushrooms, corn, artichokes, and lima beans. Also, by eating less meat and dairy, which contain saturated fats, and instead choosing plant sources of protein, you can lower your cholesterol. As I mentioned before, beans are soluble fiber superstars. 1 cup of black beans has almost 5 grams of soluble fiber. Other plant-based foods that are good sources of protein include peas, lentils, soy, and nuts. Another dietary habit that can lower your cholesterol is limiting your refined sugars and refined grains. So what do I mean by refined sugars? So refined sugars come from sugar cane or sugar beets that have been processed to extract the sugar. They're found in cakes and cookies, cereals, sodas, and many other foods including ketchup, some pasta sauces, flavored yogurts, and other processed foods. When you take in too much sugar, you store that excess amount in your liver as triglycerides. And as I mentioned earlier, triglycerides are a type of fat that can cling to your artery walls as it travels through the bloodstream. Refined sugars also appear to lower our HDL, the so-called good cholesterol. Now, refined grains such as white flour or white bread, white rice, white pasta have had the fiber and many vitamins removed. Since there is very little fiber in these foods, they are not a heart-healthy food. What other lifestyle changes can help lower your cholesterol? Moderate physical activity can help raise your high-density lipoprotein or your HDL cholesterol. So that would include aerobic exercises such as walking, running, swimming, biking, and dancing. If you smoke, stop. Quitting might improve your HDL cholesterol levels. And lose weight. Carrying even a few extra pounds contributes to high cholesterol. Did you know that losing as little as 5 to 10% of your weight can improve your cholesterol levels? By adapting these lifestyle changes, you can slash your LDL cholesterol by as much as 20 to 30%. So choose healthy fats. Enjoy plenty of fruits and vegetables. Include soluble fiber foods. Eat plant sources of protein. Limit your refined sugars and grains. And discuss any supplements you are considering taking with your physician. So here are some real-life changes that you can make. Eat fatty fish at least twice weekly. Snack on a handful of nuts instead of sweets. Add texture and creaminess to a sandwich with avocado in place of mayonnaise. When baking, replace a quarter cup of the butter with 3 tablespoons of olive oil or avocado oil. Eat a salad for lunch and toss 1/2 cup of beans onto your salad. For breakfast, enjoy a bowl of oatmeal with berries. If you are interested in individualized support to improve your heart health, contact one of Doylestown Hospital's outpatient nutritionists at 215-345-2168. Thanks so much.